Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolf. This is our daily update on COVID-19 in our community. We begin tonight's update with some sad news. Today we confirm that 5 more people from the Southeast Nursing and Rehabilitation Center have passed away. Another woman in her 60s also passed away after testing positive to COVID-19. That brings the total number of facility residents who have passed on to 8. 18 of our friends and neighbors in our community have now succumbed to COVID-19 in total. Our deepest condolences to their families and loved ones as they grieve. These next few weeks will be difficult. As we test more people, we are seeing more confirmed cases of COVID-19. That's the reality. When the numbers are updated on our website tonight at 7 o'clock, we will have 503 cases of COVID-19 confirmed in our community, and that's up from 456 yesterday. We have 124 travel-related cases and 150 community transmission cases, with the largest number of cases, 179, coming as a result of close contact with another person who is already positive for COVID-19. 50 cases remain under investigation. As we reported yesterday, we are thankful 77 people have fully recovered from the virus. Of the 503 cases that are confirmed, 88 people are now being hospitalized. 51 patients are in intensive care, and tonight 40 are on ventilators. Metro Health and the San Antonio Fire Department continue to visit all nursing homes across the city, and so far we have no other localized outbreaks to report in nursing facilities. Judge?
Yeah, well, thank you, Mayor. Thanks for that update. I think it's important for people to really understand why we're doing this, and we just need to refer back in history. The Spanish flu that was in 1918, there were no masks, there were no preventive issues, there was nothing that said stay at home, and that went on for some 6 months and devastated the country and the world. Some 500 million people were infected, some 20 million people died, and that's why we're taking all these measures to make sure something like that never happens again. I know medicine is better today, but the preventive piece was not there back in 1918, and that's why we're all pushing so hard, not only here, but across the world, to get everybody to understand social distances and staying at home. So I want to thank everybody again for working with us, not just thinking about yourself, but about thinking about others. That the health of our community overall is really what we're all working toward, each and every one of us. So please continue to do the stay at home, work at home, only go out for essential things, and to be sure keeping your hands clean and staying 6 foot away from each other. The VIA bus driver was announced today that he was tested positive. VIA is right in their throes right now of notifying everybody that's on that route to make sure they're all okay, and if need to be tested, they'll be ready to do it. Again, that's a first line person out there risking their lives every day for the benefit of everybody else. We're all having to make sacrifices here. I know every home's having to make it. I know some people have been furloughed. Some people their wages have been cut. We're having the same issues that we have to face as a county and as a city government. The city's faced with financial problems, and so are we. So we had to take a number of issues today. We're not letting anybody go, but we're putting in place a firing freeze. No discretionary spending is going to be allowed. No new capital projects that require funding are going to be approved. And we've worked really hard to make sure that our employees do not get furloughed, do not get laid off, but we're going to have to take these measures to be sure and preserve their jobs. We're all in good financial shape, but with the way things are going, it's going to take a real strain on all of us, both at the county and city level. So thanks for the sacrifices you're making. I hope we get through this in a week or so, a week or two maybe, and if we all hang together, we will get through sooner than later.
Thank you, Judge. And we are all in this together, and there's so many people and organizations that are working hard to keep each and every one of us safe. So before we close, I also want to give a shout out to CPS Energy and the San Antonio Water System, their CEOs, Paula Gold-Williams and Robert Puente. These are our publicly owned utilities. They deliver essential services seamlessly while we weather this COVID-19 storm, and they're stepping up to make sure that nobody gets disconnected and that late fees are waived. So kudos to Robert and Paula and to their teams serving our community every step of the way. As always, you can get the latest information on COVID-19 by subscribing to the text program. Just text COSA.gov to 55000, or you can visit sanantonio.gov/COVID-19. We all have to do our part to slow the spread of COVID-19. So stay home when you can, but especially if you are sick, stay home. Wash your hands with soap and water, cover your coughs, leave groceries for your neighbors, and only buy what you need. We are going to get through this. And so now we'll take some questions.
Can you talk about how you guys learned of the new deaths? It seems like the notifications came only because the city asked the facility for that information.
Are you talking about the Southeast Center?
Mm-hmm.
Yeah, I was concerned and frankly a little upset that we were just notified today of the 5 additional fatalities that occurred between Sunday and Monday. So we were just notified today, and frankly that needs to be done on a little bit more effective basis.
The nursing home said that it would cooperate with information, etc., with the city, but seeing that they have withheld this kind of information, what action can and will the city take moving forward with regards to that particular nursing home?
Well, I mean, it means that we have to place the highest level of scrutiny as we move through and make sure that we contain this localized outbreak. This is a state licensed facility, though, so it is governed by the state. We're going to continue to do everything we can to make sure that the residents there get the care that they need, and also the staff also has the proper precautions.
And that issue's not over there yet. I think we have 8 in the hospital now.
Yeah, that's right.
And these are all elderly patients, many with existing conditions. And it's going to be pretty tough, I think, over the next few days as they try to do what they can to save their life in the hospital.
What do you say to the families whose loved ones are there, they cannot see them, they cannot speak on their behalf, they're not getting the information that they feel they need?
Well, I would say that, you know, our heart breaks along with them, and that we're going to do everything within our power as a city to make sure that their loved ones are cared for and they get the, you know, proper respect that they deserve. You know, this is a pandemic, and it's very difficult for all of us who are isolated from loved ones, especially those who are sick and elderly. So we want to make sure that we keep them foremost in our minds as we move through this.
They are able to communicate with them over the phone and issues like that, but we have strictly prohibited anybody visiting that nursing home. That would make matters even worse. I know it's very, very tough to do, and I think I've mentioned it before. My cousin has a son there that happens to be 49, and it's very hard on the families. Now, if families have the means to take them home, if they're not positive, they can certainly do that with working with the nursing home to do that.
One of the things I noticed in the data that the city pushed out today was race and ethnicity among the deceased. That was at least for 9 of the people that have passed so far out of the 18. Does the city plan to release the data of the race and ethnicity data of the previous deaths and any more going forward?
So the race and ethnicity data that will be updated on the website tonight is going to be all of the known confirmed positive cases. In some cases, we don't have access to some of the data, but everything that we have access to that we can release, we're going to do that, and that includes the race ethnicity.
That will be more meaningful. We've had 18 deaths now, but remember, 8 of those.
This daily briefing is continuing right now on KENS5.com, the KENS5 app, and the KENS5 Facebook page. And real quick, here are the latest numbers. There's now 503 total cases, total deaths increased to 18, and we reported that earlier because there were additional deaths from the Southeast Nursing and Rehabilitation Center outbreak. The mayor says the city is working hard to make sure there are no other outbreaks at other area nursing homes. The judge says they are not letting anyone go at the county and are working to make sure no one is laid off in the future. We're going to take a quick break. We will be right back.